Every family has a choice, follow the herd or carve their own path. This is the Lone Wolfe Podcast. Are you ready to stray from the pack?
Welcome to the Lone Wolfe Podcast. Hello!
Welcome to Lone Wolfe Podcast. I'm Jordan and this is Morgan, and we sold our home and everything that we own to move into a 22-foot pull trailer with our two girls. We chose this lifestyle that is a little bit unconventional to find freedom and to have sovereignty within our family. We're having real conversations along the way, and today we are talking about breasts.
I don't know if I've ever heard you say breasts.
It's the breast way to say it.
Stop. We're going to start it off kind of similar to last week's episode and hit it off with cosmetic surgery.
Yeah.
And yes, circumcision is cosmetic surgery. And if you don't believe me, go back and listen to our previous episode. But we're talking about breast implants. So I had to dig into the statistics on it a little bit because I don't know about you, but there was a period of time that I used to follow a lot more fitness influencer accounts. And now I follow a lot more motherhood, natural beauty accounts that really nobody that I follow has implants.
Yeah.
But when I was following more fit, what do they call them? Fit influencers or something? Okay. So. The fitness influencers, a lot of them have augmentation. That's very common.
Yeah, for sure.
I think especially, because there's a big beauty standard pressure that plays a big role in why women get implants in the first place. And when you're very low body fat and you're putting on a lot of muscle as women, you typically lose your breasts.
Yeah. And
so women want to have the full shape, and we'll get implants. Anyway, I saw that was more of my following base on social media, so many explants.
Really?
So many. And the first one that I saw, I remember being like, why would you do that? Because when I was young, I used to be like, oh yeah, once I'm older, I'm definitely getting a boob job. Because I've always had smaller boobs. And it, to be honest, never bothered me. But there were weird societal pressures that made me think that I should be bothered by it.
Right.
You know what I mean? So it's okay, well, someday I'll just go get implants so that I can fit in with everybody.
Yeah.
So I couldn't believe why somebody would take them out, For
sure. Well, I didn't know until recently that they don't last a lifetime.
No.
You have to get them redone eventually.
I think it's every 10 to 15 years or something.
Yeah, that's kind of nuts.
Yeah. And most this is, I'm guessing, I don't know this, but I'm assuming most women get the implants in pretty young.
Yeah.
So I know.
You got to remember, I came from Las Vegas nightlife.
Yeah.
Where 95% of the women that are working in there have breast implants or are getting them.
Yeah.
And
they start young at 20 or younger.
Yeah, I know multiple girls that had got them at 20 years old.
Yeah.
I know someone that got it at 18.
So then, you have to get them potentially at 30.
You're literally setting yourself up for a life of plastic surgery.
Yeah, well,
at least
sounds like
a couple.
Sounds like a good financial investment on the cosmetic surgeon's behalf.
Here we go. Yes, there are a ton of women that have gotten breast implants. Do you think that as of lately, just because of the stuff that's circulating about how bad they are for your body, do you think that less women are getting them?
Okay, so I literally looked that exact thing up because I was curious as well. And from what I could find, no, there's actually more women getting them. It's slowly still, on the rise, but I think right now it's starting to maybe plateau a little bit, but there's not a decrease in women getting them at all. There's a huge increase in explants.
Dang.
So it's kind of a lot of the women who got them probably in their early 20s are now getting into their 30s, 40s and are getting them out. And there has been a lot of circulating things about potential health impacts of implants that were kind of dismissed or brushed under the rug probably for many generations prior.
Yeah. And you also have to remember, like, social media is bigger than ever.
Mhm.
And it is now, like, image to the younger generation is a really, really big deal. I feel like they're a little bit more vain.
Or insecure.
Yeah, or insecure than other generations. And that's because they're being judged and judging others constantly by what they look like through a little screen in their hand.
Yeah.
And so there's probably still a huge demand for breast implants because they see the fitness influencers and the bikini models, and they're like, that's what I need to look like, because that's what guys that I know are attracted to, because that's what they're literally seeing. But that's obviously not, like, that's not a real life. That's not a real person.
It's kind of sick and twisted if you like put our previous episode and this one together, where we were talking about like porn rates and the damage that that's doing to men, but it also, like, women know that all men are watching porn. Like, we know that. So then we feel that pressure of like, well, my boyfriend won't be into me if I don't look like a porn star.
Right.
Because having these massive fake breasts, like that, you know, are up to here, and the tight cleavage and all those things are not natural to a woman's body at all. Like, breasts don't look like that. No. And I've seen a lot of boobs as a lactation consultant. Yeah. I've seen a lot of boobs. They do not look like that naturally, you know? But there's this weird stigma, and I think also pressure that women put on themselves of, my boyfriend can barely get it up as it is. Right. You know, and I'm speaking back on our previous episodes. So if you haven't listened to that one, go listen to it for context. But it's kind of sick and twisted when you overlap the problems that are going on with men and the problems that are going on with women.
They definitely go hand in hand. The problems are overlapping for men and women.
Yeah.
For sure, especially for the younger generation.
Well, and then it's sad because we attach such a weird thing to women's breasts as if they're for everybody else except for us. Because the second a woman decides she wants to breastfeed her baby, you're ostracized in public. Literal strangers will come up to a breastfeeding woman and be like, what are you doing? Put that away. Yeah. You're so crass, and you know what I mean?
Give a dirty look.
Yeah. No, people will literally say things. I can't tell you how many times I've had moms tell me situations in public where people have the audacity to come up and tell them to cover up or put it away, or there's children around or whatever.
That's pretty wild. Are they with their husbands when this happens?
Oh, yeah.
Really?
Yeah. I actually had, so I used to.
I would lose my shit.
Yeah.
Someone told you to put your breasts away.
Oh, I'd lose my shit before you. Don't even worry. Yeah. Yeah. Or they'll be pervy. I've heard stories about that too.
Oh, I could totally see that.
Yeah. So I used to run a breastfeeding support group back when we were still in Vegas. And I remember one of the moms sharing like a rather like vulnerable story to her where she was out at a restaurant with their first baby, and the baby was like fussing. And so she like latched the baby, and her husband actually was all freaked out. He's like, what are you doing? Oh my gosh. Like, you can't do that here. You need to go to the bathroom or something. What? Yeah. And she was like, what? And so we had to like talk it all out in the group to try to figure out how she could navigate that with him, because obviously he felt really uncomfortable about it. And that's what I mean, is that breasts are so sexualized that
Right. Was he worried because like he was embarrassed that she was doing it, or was he worried that somebody was going to look at her?
I feel like kind of all of it. You know what I mean? And I mean, I get it, because that's like the weird societal standards that breasts are sexual. So lifting your shirt up and somebody seeing your bra or something is sexual in our society. But feeding a child is not sexual. It's
at all
biological, right? And it's actually completely necessary.
Yeah.
And then another interesting thing that I observe, because I can't help it, but anytime we are like out and about in like social settings, I will always notice the moms that breastfeed, because they're way harder to find than the moms who are bottle feeding. And what makes me so sad about it is that they probably are not exclusively bottle fed. Like, their dynamic is probably not exclusive bottles. I know a handful of women who will breastfeed at home exclusively,
but bring bottles in public.
But yet bring bottles in public because they're scared to breastfeed in public.
Okay.
They don't want to like cause a scene. They're scared about like an altercation or like somebody judging them or getting a dirty look or whatever. Like, not all people are as bold. Yeah. Like, I have no problem breastfeeding my children in public. That does not bother me. Yeah. And it's so discreet. It's not like I'm like putting my shirt over my head and like dangling my boobs around. You know what I mean?
You've only done that a couple times.
Well, yeah. It depends on how fussy the baby is. From the conception of our species, women have been nourished by wild foods, medicinal plants, and the entire animal nose to tail. And that's exactly what Birthright brings back to life. These supplements are made from real food ingredients like grass-fed liver, bone marrow, and fish eggs, paired with powerful herbs that support every stage of womanhood. I'm currently taking Revive to prepare my body for conception after going through infertility and IVF. Truly never felt so aligned with a supplement. It's not synthetic or filler-packed, it's ancestral nutrition in a capsule form. Whether you're rebuilding your health before pregnancy or searching for a prenatal you can trust, Birthright offers a collection of whole food blends designed to honor your hormones, fertility, and vitality, the way that nature intended it. Reclaim your health through nourishment that's wild, wise, and time-tested. Use code Lone Wolfe for 15% off at birthright.co. That's Lone, WOLFE, for 15% off your first order at Birthright Supplements. Because optimal health, fertility, and wholeness is your birthright. But yeah, I mean, there are just the weirdest, like, you know, but nobody would judge a mom if she was just bottle feeding her baby in public.
Right. Everyone's gonna be like, that's just normal.
Yeah, that's normal. But like, if
But
a woman were to like, no, it's not normal at all. Like,
it's actually not.
It's not.
It would be normal for you to feed your child from the breast that your God gave you.
Exactly. But instead, we put a huge sexual label on our breasts, and they can't possibly be seen as like anything else.
Yeah, it's weird how breastfeeding has become like a taboo thing in Western culture, because I feel like in other cultures, it's not as like...
Well, I have a funny feeling other countries aren't in bed with formula companies and Big Baby as deep as we are. But that's probably another episode.
That's very true.
Because
you go down a big rabbit hole there.
Yeah.
The
formula companies literally lobby against maternity leave because it's not easy for them to stay home with their baby, and they're forced to return back to work sooner than they're ready. Then it's more likely that they won't have successful breastfeeding and they'll turn to formula.
Oh, yeah.
And that's just the very tip of the iceberg.
That's the very tip. Because then you go into all of the pumps and the things that you need in order to maintain the bottles and all that. It's just crazy.
So then it makes me think of this story, to bring it back to like the cosmetic piece of it. I had a client in my lactation practice who was seen, I think, by somebody before me, but she was having really severe mastitis symptoms, which is like a systemic infection. And by the time I finally saw her, I was like, why the F has nobody like done anything more for you? And she had already gone to urgent care, I think, twice at this point.
I remember this.
Yes.
You told me about
it. It was
this.
insane. Yeah. And so then I saw her and I was feeling really concerned that there's something more going on. And so I gave her protocol and then was keeping in touch with her very closely. I was like, we have about 24 hours to push this, and then you need to go to the ER. And come to find out, she ended up going to the ER. She had full-blown infection of her implants and had to get them removed completely.
Damn.
And I actually don't know, like, if she continued to breastfeed, like, long-term. You know, of course, I checked in with her after the fact, and she was healing okay and stuff and was still able to latch baby and had supply at that point. But, you know, I don't know long term. And that just makes me so sad because these young women are making these decisions to like permanently alter their bodies for the sake of weird, sick beauty standards. And I know that there are situations where for some women it's deeply personal and they want, like, I get it. Breasts are part of being a woman. And I've worked through that myself, or if you don't have big breasts, are you not as woman? You know what I mean? There can be deep-rooted things there for people. I get that. I'm not trying to dismiss it. But there are sick standards out there, and I feel like that can't be denied, that really funnel women into getting these implants. Yeah. And then now here's somebody who had multiple urgent care trips, an ER trip, now had to get them removed, which is a whole recovery after she had just given birth probably a week before that, or a week or awful. 2 weeks before that. You know what I mean? And now has to heal herself from a surgery while taking care of a newborn, and potentially could not have successful breastfeeding now because of that disruption. Yeah. And those are really like big impacts. Yeah. You know, that, and women don't think of those things, you know?
Well, especially, I mean, especially if you're getting your implants when you're really young, like we had talked about. Yeah. And you're not really thinking about having kids, or you're not really, in that mindset of like, what are the repercussions? It's purely based off of like, maybe you have very small breasts and you were made fun of in school and you just cannot wait to show people that you have breasts now. It's almost like this thing where you got to prove a point to like, well, I got these now. This is now going to make me a woman. You can get to that point where you are completely putting aside any red flags about the implant and just going forward with it because it's something that you need to have in order to feel validated as a woman.
Well, and I think that that's a good like direction, because there, I'm sure, is scenarios where women are going in for augmentation and are just blatantly like, I don't really care about all the risks and the whatever. This is just something that I need to have. But I also think there are probably just as many, if not more, women going in for augmentation and aren't even being fully informed of what the risks and implications can be.
Yeah, I'm sure that happens quite a bit. Probably give you a pamphlet.
Yeah.
And they're like, here you go. Here's what could happen. And there's like talk, I know, between the type of implant that you get and whether one is safer than the other, like silicone or saline.
I think they've like really gotten away from silicone now.
Are you sure?
I don't know. I don't know. I've never looked into them, so I don't know.
But regardless, whatever's inside of it, you're still putting a silicone bag filled with one or the other. You're
putting a foreign object into your tissue.
It's just wild, and it's right above all your vital organs.
Well, and you can ruin the blood supply in there too.
Yeah.
Where like you don't have like sensation in like your nipples anymore. And it's very rare. I don't want to like scare anybody if they're listening and they have implants and they don't have kids yet and they know they want to breastfeed. Most women who have implants are totally successful, but that is a risk. You are risking because you're going in there and it's delicate tissue, and that's where all the like ductal work is. It only takes the wrong cut to mess things up in there.
I personally know a handful of women that have gotten breast implants removed.
Yeah.
And it was all the same systemic issues where they were fatigued. They did not feel like
good
100%, where you're just like slowly getting worse and worse and you're poisoning yourself.
So that's called breast implant illness. And it's not like a technical like medicalized term just yet, and that's where there's like controversy, because there's a lot of like these cosmetic surgeons who completely disagree and are like, that's made up, BS, whatever. And then there's another group of doctors that are like, man, I'm hearing this way too much from women. I need to look into this more. Something's not right here. So the teeter-totter is still kind of unbalanced, but I personally think it makes a lot of sense. And I think a big thing to consider is we live in toxic sludge. Like there's so many inflammation producing things in our environment and our diet and our lifestyles that our bodies are already taxed as is. So then when you go and put two foreign objects into your body, it's no wonder that your detox pathways just can't hold the load. And then that will start to show up as brain fog, joint pain, hair loss, fatigue. Those are all like major symptoms that your body is screaming for help.
Yeah, you have so many lymph nodes in that area. It's just a very sensitive area. And the lymphatic drainage is probably working overtime as well, trying to get rid of all the toxins that are running through the body. And it's not able to detox the way it's properly set up to.
Well, and I think that's what really happened to my one client who ended up having to get hers removed and was really struggling with bad mastitis and fever and breast pain and all that. She had very large implants, but she just could not drain anything. That's what I felt. I don't know what her clinical report was, but
no, it's probably true.
Yeah, they were big implants. We were saying though, if implants have been increasing or decreasing, I did see though that more women are going towards a more natural look. So they're choosing smaller implants, more like fat transfers.
They're not going for like the Playboy bunny look anymore.
The next boob topic would be breast cancer, which is obviously a very prevalent cancer. I feel like everybody knows somebody who has had it. Luckily, it's typically pretty easy to treat cancer. Like, as long as it doesn't spread to other parts of the body, as long as it's local to like the breast only, treatment is typically pretty straightforward.
Is it harder to spread through the breast?
I don't know, and I'm not answering as like a professional. I'm just using my best guess here. My guess would be that most women will catch it early. You notice typically if there's suddenly something not right in your breast, like versus my dad had pancreatic cancer, and that presented as like shoulder pain for a handful of months. You know what I mean?
Right. You can't go and feel a lump on your pancreas.
Yeah, exactly. It's much harder to like pinpoint that, and typically you're not noticing those types of cancers until you're already further progressed.
Yeah, that makes
sense. Or breast
sense.
cancer, it's your boobs. Like, you typically know if something's off. And we are taught as women from a very young age to like take your fingers and go and do like work around, and there's a certain motion you do it, and you go into your armpit, and you know, like, you're told to check for lumps and things.
Yeah, there's a protocol. You just are taught from an early age that you need to just feel for the lump.
Yeah. And even if you're not feeling it all the time, I don't know, I feel like you would notice.
Yeah.
You know, I mean, I've never had breast cancer, but that's just my assumption.
Zeppelin would find out.
She would find out. Oh yeah, she knows a thing or two about mama boobies.
She knows her way around a mama boobie.
Yeah, she does. But speaking of diagnosis, we were listening to a podcast on breast cancer, I believe was the main topic.
Right.
And this doctor was talking about the mammogram, that it's potentially more harmful than we think it is. I haven't looked into it personally, but the idea that she presented makes a lot of sense. Is radiation. Right. And in any other world, radiation is bad and causes cancer. When I was in nursing school, I remember there was a couple times where we would go in for a procedure and they would always ask, like, are any women in the room? Is there any chance you could be pregnant? Are you trying to get pregnant? Because you can't be in here for the radiation.
Yeah. I mean, everybody knows radiation is bad for you.
Yeah, that's not news.
Yeah.
But we can take a breast and smash it down and beat it with radiation, and we're like, oh yeah, that's preventative medicine. It saves lives.
Right. And you're supposed to do it multiple times throughout the course of your life to prevent cancer.
Not to prevent, to catch it.
But wait, would you get... There's women that
it's
are
preventative.
getting... But women are getting mammograms without having any, like, symptoms of cancer.
Yep.
Yeah. So
it's just like colonoscopies. Like, people don't have like signs of potentially having like colon cancer or something, but they've made it, because it's such a prevalent cancer, they make these standardized like protocols of like at the age of 40 or 40. I think it used to be 45 and they recently lowered it to 40. You should go and get, you know, your colonoscopy, and then you get it every 4 years or something. It's something like that.
It's kind of a convenient way to keep people coming and giving them business.
Well, and maybe catching things that would have never like been a problem, you know,
or cleared up on their own.
Yeah. But she's presenting this idea that the mammogram's potentially creating the cancer. That maybe you could have, you know, a toxic burden, but it's not necessarily presenting as like cancer yet, because your body's always making cancer.
Right.
But it kills it off, and your body's supposed to do that, and it does it all the time. Even infants do it, right? But if your like toxic burden gets too heavy and your detox pathways aren't great, then you could be at higher risk for those cancer cells actually like growing instead of killing them off, right? Yeah. But she's saying that like you could go in and then get this mammogram and the radiation's just turning it all on.
Yeah. I mean that.
So you're literally creating cancer patients.
Right. They've scared you enough about getting breast cancer that they've literally turned your scarcity into giving yourself breast cancer.
They've turned your scarcity into standardized testing with a bow on top, telling you that mammograms save lives.
A pink bow.
Yeah, a pink bow. That's a whole level of corruption in itself.
Yeah.
I don't know if you've ever seen the type of food items that the Susan B. Komen classic pink ribbon will be on.
I'm sure it's just all the typical
candy,
the usual suspects.
Ultra processed foods,
dyes.
Yep, everything's dyed pink, so it has like red 40.
It's not real food.
And then there will also be pink ribbons on all the fragrance and stuff, which are all known endocrine disruptors.
It's kind of crazy that breast cancer awareness is a full month, right?
Yeah, it's the month of October.
Yeah, so
Mhm.
they have Breast Cancer Awareness Month.
And everybody wears pink, and then everything gets pink washed.
Right.
Like there's so much pink washing in all the stores
Right.
where all these food items turn pink, and they make you think that if you go and purchase these items with the pink ribbon, you're supporting breast cancer. But what you're doing is literally bringing cancer-causing foods into your family and then putting them into your body.
Which is in turn potentially giving you breast cancer.
Yeah.
Yeah. And it's a repeating cycle we're seeing across the board. Like it's almost like they took the playbook and they just ran with it in every direction.
Mm-hmm.
Even to the point where they're preying on the most vulnerable people because they're taking something that has been detrimental to a family member
Mm-hmm.
and then go through all this pain and this struggle, chemo, and it's a huge burden on your family to have a family member go through cancer, but they're just washing them through this cycle where it's taking away from what that person's been through and almost making it a celebration. And when you look at it from that angle, instead of being like women supporting women or corporations helping supporting women, if the corporations are doing it, it's not in your best interest.
No.
It's kind of sick.
Well, and then what's interesting is the Susan B. Komen Foundation, or I'm pretty sure it's a nonprofit.
She's the one that started it.
Yeah.
Okay.
I believe it's a $1 billion foundation now.
Oh, yeah.
But I believe it's the largest like cancer foundation in the whole country.
Probably in the world.
Probably. Which is really insane.
Yeah.
But so with really big foundations, that you have to have big funding to keep that going. So where do you think the funding comes from? You know what I mean?
Yeah.
So it's one of those things where they're out here, like you said, like preying on the innocence and the heartbreak and the vulnerability of people who have either personally or firsthand experienced cancer or have a family member or a close friend or somebody who has, and then are purchasing, you know, these items or donating their money to this cause. But none of it is working to actually like improve or cure or like help women battle cancer. Susan B. Komen has this history of really pushing the like diagnostic things.
Right.
So like very big on like the mammogram and like screening and early detection things, but in no way is there ever emphasis on environmental toxins or endocrine disruptors or the things that are actually causing the cancer.
Yeah.
Instead, she's literally taking a pink ribbon and slapping out on all the things that are literally known. It's 2026. These things are known to cause cancer. But if she were to admit that they did, there goes all the funding.
It's the same thing with the entire medical system. It's reactionary medicine. It's not preventative.
No, yeah, it's not preventative.
Maybe let's take a look at what you're eating. Let's take a look at what you're putting into your skin, what you're breathing in your home. Maybe we should look into why we're getting it in the first place.
See, but this is like even more sick and twisted because potentially not only are they like not looking at the preventative, but they're actually like promoting it. They're literally promoting the things that cause breast cancer and putting their brand on it.
I know you and I, we're not shocked anymore.
Yeah, no, but like...
But if you're hearing this, like, and you're just diving into the, I don't even want to say conspiracy world because it's not anymore. It's like, once you kind of just let go and you go, well, you know what? If this is fucked, then that's fucked. And then that's fucked too. And it's like you start to play all these scenarios out. It's almost brainwashing because you trust the people that are telling you this. You trust your doctors. And I don't think that doctors are bad. I really don't. I think that I
think the system is bad.
I think the system is bad. And the system has control over how the doctors are trained and what they're told. And the doctors,
and how they are allowed to act and treat and...
Right. Yeah. And so that's if you are going to fit within that system and be a successful doctor, then of course you're going to go and you're going to, kind of buy into what they're selling you. Because at the end of the day, you're like, well, I'm helping people. It sounds like there are some doctors that are waking up to it and that are actually out there trying to like fight the good fight and bring more relevant nuance to some of these systems that are outdated and pushing stuff that we know is now bad.
Mm-hmm.
Kind of like the podcast that we listened to. I don't remember her name, but she did a great job of kind of explaining how she came into all of this. And it's cool because she actually mentioned there are ways to screen for breast cancer without using a mammogram or radiation.
And it's affordable and...
Yeah. So there are ways to do that. Why isn't that standard practice?
You have to remember that she was a cash pay practice because she doesn't work with insurances, because insurances don't actually have your health in mind. Your health is not of their best interest.
Right.
That's why.
Yeah.
Insurances probably don't cover those things at all. I literally just saw this video that came up. Oh no, you sent it to me. It was from you.
Yeah.
The guy who...
the insurance guy.
Yeah, he like calls his insurance and is like, hey, you know, I got this bill for my daughter. And they had billed it before we gave our insurance, and so I gave the insurance, and now I got my bill back and it's higher.
Right.
And they're like, oh yeah, well that's the discount for if you're not insured. And he's like, well, if I cancel my insurance, can I have the discount? And he's like, no. He's like, so I should have just canceled it before I took her to the ER or whatever it was.
He's like, well, no, but you're insured, so you don't get the discount.
Yeah.
Okay, so next time I'll just cancel my insurance. He goes, so if something else happens, I get the discount.
Yeah.
And he goes, yes, if you don't have insurance, you get the discounted rate. It was like,
yeah.
And he's just kind of looking at like the camera like, okay, this is crazy.
What?
We experienced that too.
Yeah, we have.
We've experienced that.
Yep.
You know, taking our kids because they cut their head open and getting multiple bills and being like, okay, what's the point of paying $800 a month for insurance?
Exactly. To get a $600 bill because 10 minutes of SpongeBob played on the TV.
Yeah.
Literally, that's it.
Because
she didn't even get a cup of water.
Because you told my kids some dumbass joke and nobody laughed at it while you're putting glue on their forehead.
That was it. That was our whole stay. Yeah. They wanted to charge a $600 like facility fee.
It's crazy.
Yeah. But if you were cash pay, like it probably could have been like half that. Yeah. So anyway, this lady was a cash pay practice, and that's probably part of why it's easy to get her clients in to do this alternative screening method instead of the mammogram.
Oh, for sure.
Because insurance is huge. It incentivizes, you know, it really controls a lot of the medical world.
Yeah. Well, if you start to tell a surgeon that we're actually going to be trying to get away from doing these surgeries because, one, they're not working and there's other alternative methods to treat this or preventative methods, then that surgeon's going, well, man, my job's going to be gone. And it's the same thing with it's the same thing across the board. As a plastic surgeon, obviously you're not going to tell somebody about the, you know, harsh realities of what these can do to your body over time, because
that's a threat.
You want people to keep coming back. And then what they can do again is turn around, and once they do get these symptoms, they got to go back to the surgeon to get them out. So it's like, it's a win-win for them. As long as you're getting the implant, they know that they got you for at least 2 surgeries.
I do just want to touch on like one thing that I think is interesting and relevant, because if you're a new listener here, Jordan and I went through infertility. I guess we are still going through infertility now, and we have done a 3-part series on that on the podcast as well, if you want to hear our whole story and take on everything. But infertility, as I feel like most people know now, is becoming insanely prevalent. So many people are struggling to conceive now. It's a true epidemic. But infertility can set the stage for breast cancer.
That's pretty interesting. And
that's a scary thing.
Yeah.
Like it was pretty scary for me hearing that. I mean, I didn't know this when we were listening, but like I just had a immediate family member get diagnosed with breast cancer just a couple days ago.
Yep.
And then I'm sitting here hearing how infertility and PCOS can set you up for a higher risk of breast cancer.
Yeah.
And that's scary. That's when it starts to feel really real, that like we can sit here and talk how everything's toxic and whatever, and that's the world, and accept it at face value and just kind of be aloof with it and whatever. Right. But then you hear things like that, and then it's like, well, fuck, this could be personal. Right. You know what I mean?
Yeah.
Then it's a lot harder to just be like, oh, the systems are fucked, you know, because then when you actually have the illness and you're trying to figure it out in a corrupt system. I can't even imagine what that experience is like for people.
Yeah. And I mean, also, like IVF treatment that you did could be potentially causing...
Yeah, it increases your risk for cancer. And that was in the consent forms. Like, but I mean, there was a whole page on the increased risk of female cancers going through IVF. And it's one of those things where you read it and you're like, yeah, it wouldn't happen to me though.
Well, yeah, and
sign here.
And you're infertile and you're desperate for a baby.
Exactly. I guess my point is just that these topics all like run really deep and can all be really interconnected. We have all these things that are potentially indirectly or directly driving infertility rates in the US. And then we take these people who are infertile, knowing that alone, having these hormone imbalances and metabolic problems are increasing your risk for cancer. And instead of figuring out what's going on and treating that root cause, we just diagnose everybody with unexplained or whatever. Even if you do get a diagnosis, you're then funneled into IVF, which is now another place where you're going to be loading this woman with this another toxic burden and messing with hormones and then increasing her risk even higher of having cancer.
Yeah.
How many ways are they trying to get us?
While simultaneously never figuring out the root cause.
Or giving a shit about it. They could figure it out.
Fertility is a vital sign, and we've talked about that before.
Yeah.
But it goes with the entire medical system that they have. It's like they don't care why it's happening. They only care that it is happening, and they have a solution for you. They have a treatment for you. They've got a mammogram for you. And that's where you start to go, maybe I have to start working backwards rather than going forward into the medical system.
Yep. And I think we can kind of wrap it up similar to our male part 1 dick dilemma. That I think seeing this increase in explant surgeries, seeing more women go for, if they are going to do augmentation, that they're going at least for more natural, either shape and size or even potentially like fat transfers, like more natural, holistic ways of getting like your desired look. That women are speaking up on social media, on big platforms, being like, there is pink washing happening and this is not for women. This is not good for us. There are women starting to be like, I'm not going to necessarily do all these diagnostic screenings. Like whether it's mammogram, there's also been a lot of things on the pap smear and other gynecological things where women are kind of like, maybe that's actually harming me more than it's benefiting me. People are just becoming more aware. And I think that that's so important because while these systems are big and it feels like there's so much, against us. And it's a really big fight. The more we question and the more we wake up and the more we push back, that becomes a movement. When you stop buying the food items with the pink ribbon on it,
they stop selling it.
Yeah, and it stops happening. Those companies aren't making the sales that they want anymore. Deals fall through. It matters. The more women start being like, hey, I think that there is something seriously worth paying attention to happening to women that are getting implants, the more doctors will start to be like, you know what? I'm hearing the voices of these women coming to me saying that something's not right, instead of just dismissing all the time. Like, and then it's, they start to have conversations with their peers and be like, hey, have people been coming to you and sharing these experiences? There's such a ripple effect. I think that's kind of where the heart of Lone Wolfe comes, is if we can provide opportunity for more people to be a part of conversations that people don't want us to have. And that you can have your mind woken up to some deeper concepts. I think that positive can come from that.
For sure.
And I mean, we're fighting for like the next generation here.
Yeah, we're fighting for our daughters.
Exactly. We have 2 daughters and I don't ever want to see either of them experience infertility. I don't want to see them experience breast cancer. I don't want them to ever feel like they have to go get augmentation because the men in our society are completely crippled by porn addictions.
Or they feel that, society has judged them so hard that it's something that they need in order to fit in.
Or be accepted or I want nothing to do with it, and I don't want it for your family either, because I have a funny feeling if you're here listening, you're probably somewhat like-minded to us.
But I like what you said, though. I agree with you. I think there is an awakening happening.
Mm-hmm.
And I think that men and women are starting to realize, and that is kind of one of the beauties of social media and access to information, that you can actually get into a like-minded group of people that can influence you to question things a little bit more.
Yep, and if you don't know where to find that group, welcome to our pack of loners.
You found it.
Yep. We have new episodes coming out every Monday, and I hope you guys will stick around for what's next.
See you next Monday.
If you feel at home here, leaving a 5-star review helps other families find their way too.
Come hang out with us on socials at Lone Wolfe Podcast, and don't forget to subscribe so you don't miss what's next.
Remember, sometimes you have to stray from the pack to discover where you truly belong. Until next time, loners.